Welcome to this health talk on anxiety disorders, knowing more about them. Now, I would like to start by asking all of you a question that have any of you ever had palpitations, a little difficulty in breathing, or loss of appetite before you were about to appear for an examination, or perhaps the night before you were going to get married, or any such situation? I am sure all of you would have experienced. Has anyone not experienced this sort of a feeling? Have you not? Have you not?
Always, most of the time, recurring.
Yeah, so now we are coming to that. So basically what I am trying to get at is that anxiety is a normal occurrence if it happens once in a while. All of us go through anxiety, all of us go through situations which cause us to get worried or anxious, but those are transient. They don't keep recurring and they are not of a permanent nature. So that is the first thing I would like to start with, that anxiety per se is not a problem. So when we are talking about anxiety, it is basically a feeling of apprehension which all of us have. It is a fear of the unknown. Whenever you are going to any particular place or you are traveling through a jungle or something like that, it is a fear of the unknown which causes an apprehension. So that is basically anxiety, which causes an uneasiness, and you feel a little distressed. Now this anxiety, I am talking now of not anxiety disorder, I am only talking about anxiety. So anxiety is accompanied by symptoms such as there could be a headache, there could be sweating, there could be rapid beating of the heart or palpitations, there could be a feeling of tightness in the chest, or sometimes you get a stomach discomfort. That means you feel like butterflies in the stomach, as it is described normally, and also feeling of restlessness. And all these presentation or these symptoms depend upon a person. It depends from person to person how much of coping mechanisms they have. Many of us are able to cope better than other persons. Some people are there who can cope a lot of problems, and they can face a lot of problems without getting anxious about it. Like, for example, I'll talk about a soldier, because I am basically a soldier. 29 years I have served in the armed forces. So when you are going to a war, at that time there is anxiety, but at the same time a soldier is trained for withstanding that situation, so he does not feel that anxious. As a layman, if a layman was in that same situation, he would have reacted differently. So different people react differently to the situations. Now basically anxiety is arising out of fear. As I told you, it's a fear of the unknown. So it is a fear response. Now a fear response can be adaptive fear or it can be maladaptive fear. So every one of us feels scared, and if it is a realistic, that means there is some danger, we are scared of it or we feel anxiety about it. And this anxiety or fear is usually proportionate to the amount of threat. Suppose someone is pointing a gun at you. Okay, so you are scared and you will be very anxious. You will have all the symptoms of anxiety. But that is because it is a threat to your life. Okay, so it has to be in proportion to the threat, and the fear response normally subsides when the threat is no more there. The moment the threat is removed, then this response of your mind to this threat also goes along with that. Okay, but maladaptive anxiety, which we are going to talk about today, that is anxiety disorder, that is unrealistic. That means it is not a realistic concern, it's an unrealistic concern, and it is totally out of proportion to the threat. That means there may not be any threat existing. Okay, there may not be any threat existing, yet the person is showing anxiety symptoms, and this is absolutely out of proportion to whatever little threat may be there. And this response of the human mind and the body is much longer lasting and persistent and becomes chronic. So this is what we are going to discuss today in terms of anxiety disorders. So normal anxiety is an adaptive response. It is meant for adapting the body response to any threat. Whereas, whenever the response is much beyond than what it is supposed to be normally, then it results in cognitive symptoms, that is worry, and somatic, that means bodily symptoms. That means symptoms of the mind or cognition, that is in terms of worry, and symptoms in the body, which will be in the form of racing heart, sweating, shaking or shivering, etc. So this pathologic anxiety, that means the anxiety which is lasting, which is much more in proportion than the actual threat, or there may not be any threat at all, yet we are responding by way of anxiety. That is known as pathological anxiety, and that is what we are going to discuss today about anxiety disorders. So I hope that much is clear, that it is not a normal. All of us have normal anxiety, but what we are going to discuss today is something which is an abnormal form of the anxiety state. Now, anxiety disorders are quite common, and they have a very early onset. Usually the onset is in the teens or in the early 20s. Women are twice as prone to develop anxiety disorders as men are, and anxiety disorders also has a waxing and waning. That means sometimes the person becomes very anxious and develops too much of these symptoms, and again at times over time period it comes down. It's like waves. So it reaches a crescendo, comes down, again reaches a crescendo, comes down. And in terms of other diseases like diabetes mellitus or major depression, etc., it is debilitating in terms of, that means causes functional impairment. So the person cannot do the normal activities of the life, whatever the routine activities of life is involved, and how the person, like all of us, we get up in the morning, get ready, go for work, come back, we play with our children, laugh and joke. Now this pattern of life gets disturbed by the anxiety disorder. Common causes of anxiety disorders: one is genetic, that means from familial, that means from parents or from grandparents we get this thing. So genetic thing is definitely proved that there is genetically it can be transmitted. Then the second is that there are certain chemicals in our brain, and when there is a disturbance in these chemicals or increased amount of these chemicals, then it can cause again anxiety disorders. So I am not going to the names of the chemicals, etc., but there are serotonin is there, adrenaline is there, many other types of chemicals are there in the brain, which actually also involve the fight or flight response. Now, fight or flight response is a response which has been noted in physiology, where in a person, whenever a person is faced with a threat, then the body takes recourse to the secretion of these chemicals. Adrenaline and noradrenaline are the main chemicals which are secreted in the blood, and both these chemicals causes the heart to pound faster, supplying more blood to the muscles, and that the action can be either that you fight against that threat, or you run. So if you see a tiger in front of you, then you might take to flight, you might run away. But if it is a lesser threat, then you might stand and fight. So this fight and flight reaction is the normal body reaction which is induced by these chemicals known as noradrenaline and adrenaline. Then there are also life circumstances. That means, as I told you right in the beginning, that the capability of an individual to withstand stress or to withstand any form of adversity depends. So there might be one individual who may be able to withstand adversity. There are other individuals who are not able to withstand that adversity, and they go into a state of, so life circumstances also depend. And finally, the personality, type of personality, we have different types of personalities. So different types, the personality type will also cause this thing. That means basically we have two types of personality, type A personality and type B personality. Type A personality are those who are hyper competitive, who are always wanting to be very accurate in doing their things, very fastidious. They want if a thing is to be kept here, it has to be absolutely properly kept. Whereas a person who is a type B personality is cool and calm and takes life easy. So the type A personality are more likely to develop anxiety disorders than a type B personality. The type B personality feels that even if the whole world comes to an end, nothing is going to go wrong. So such people don't develop anxiety disorders. A type A personality will. Then there are certain drugs which people may take, like amphetamines are taken by some of the students to remain awake at night and read. Now amphetamines definitely cause thing, and there are some of the other drugs which are banned drugs which some people can take, and that can also lead to these anxiety disorders, or the withdrawal of these drugs can result in anxiety disorders. Here is also alcohol is also one of them. So if a person becomes a chronic alcoholic and you are trying to withdraw that person from alcohol, he will go into a state of anxiety disorders. In very rare cases, there is a particular type of tumor, which is a tumor of the adrenal gland or suprarenal gland. This tumor is called pheochromocytoma, and this causes increased liberation of adrenaline and noradrenaline, leading to anxiety disorders. So these are various factors or causes which can lead to anxiety disorders. Now we come to the symptoms of anxiety disorders. It is in 4 different types of symptoms can be there. One is somatic. Soma means the body. The somatic means anything to do with the body. Emotional is dealing with the emotions. Cognitive is our understanding or knowledge and understanding of the brain. And behavioral is something to do with our behavior, the behavior pattern. So as far as the body is concerned, it can you can have symptoms like goose pimples coming up, or muscles becoming tense, the heart racing, respiratory rate goes up, and all that thing. I will not go through all of them. It is there for you to read. As far as emotional is concerned, there is always a feeling of dread or a feeling of terror, as if there's something very huge in front of us which is going to cause us harm, and the world is going to come to an end, or our life is going to end. So that sort of a feeling of dread is there, a feeling of restlessness and irritability. In terms of cognition or understanding, we always feel that there is a sense of harm, that we are going to be harmed, and the danger which is there, we exaggerate that danger. That means the person with anxiety disorder will exaggerate that danger. Even if it is a small problem, he will exaggerate it and inflate it, and think that this is going to cause a lot of problems, and that's how there is a fear of losing control, fear of dying, and this entire thing is actually unreal. It is not real. That in reality that is not existing, but they make it very, very large in their mind, and that's how the cognitive aspect comes in, and the person feels very restless and develops all these symptoms. In terms of behavior, there is also a tendency to escape. A person tries to escape from that harm because he is not able to overcome that, or there could be opposite. That means there could be aggression. That means fight and flight, I told you. So either there could be fighting, that means aggression can be there, or running away from it. Either of these situations, or the person can absolutely freeze. That means freeze into inaction, where the person submits himself or herself to the unreal danger, which is not a real danger. And these are the things which could result in behavioral changes which will come in. There could be decreased appetite, and there could be other increased aversive responses. That means when you normally communicate with a person, the person communicates with you normally, but a person in having anxiety disorder can become aggressive. That means you ask that person, what is your name? He tells you, why do you want to know my name? Why should I tell you my name? No, it's that aggression. So it could be either total submission or it could be aggression. So these are all the behavioral changes which can be seen. Now this is the list of various anxiety disorders. That means generalized anxiety disorders, which is in general, it's a generalized anxiety disorders. Then we have post-traumatic stress disorder. Now today I will be concentrating only on these two types of anxiety disorders. Apart from that, you have panic disorder, where a person panics, and this panic disorder comes on suddenly. He is suppose walking on the street, suddenly he feels that he is being cornered and he has no place to escape, and that sort of a feeling of insecurity comes in. So a panic disorder is a typical type of disorder. Then we have obsessive compulsive disorder, where a person feels obsessed to do something repeatedly. Now obsessive compulsive disorder is seen in many women who keep cleaning the floor or cleaning the utensils or cleaning the hands, 10 times, 20 times in a day, because they feel that there is some contamination, some germ is there. Okay, so this is a obsession in the mind, and the compulsion, that obsession is making that person compulsive to act. So the action is the compulsion. Obsession is in the mind, and the action which is being performed is the compulsion, out of which the obsession is, because they feel that if they act, then that obsession will go, but actually it doesn't happen. So it is a vicious circle which they go through. Then we have social phobia. Social phobia, I have shown a picture, like if I am giving you this talk. Now if I have a social phobia, then I'll stutter, stammer, I'll feel very uncomfortable, because I'll feel that you are judging me, and I'm not being able to perform properly. And so these are the things of social phobia, where a person has very low self-esteem and is not able to face the community and feels always that the community is judging him or her. Then we have specific phobias, where a person is very, very scared of maybe heights, or maybe sitting in a room. If a person is scared of sitting in a room, that is known as claustrophobia. So similarly, they have some people can have if they go to a height, they feel very scared. Seeing a snake, they become they may totally freeze. So these have different names. I am not going to the different names. Some people are very scared of spiders. So different types of specific phobias are there. Phobia basically means fear. Phobia stands for fear. So being fearful of a particular object or a particular situation. There are specific phobias. Then substance induced anxiety disorders, that means the people who take drugs, different types of drugs, substance abuse, they are prone to specific types of anxiety disorders. So these are all different types of anxiety disorders, out of which I will discuss only the first two. Now coming to the generalized anxiety disorders, basically the people who have GAD, they suffer from severe worry. That means they are always worrying, and their worry or anxiety is out of proportion to the actual situation which is existing. So such people are described as worrying people or nervous people, and they have difficulty in controlling their worry. Now when you confront them and you ask them, what are you worrying about? What is the problem? Now as far as they are concerned, that they are seeing that as a problem, but there may not be any problem actually present. So many of us worry. It's not worrying, it by itself is not abnormal. Many of us worry, but when we worry, we do a constructive thinking. That means if there is a problem, we worry or think about it, but we are thinking constructively, seeking solutions. Strategizing, seeking solutions to overcome that problem. But such people, their worry is without any, it is not leading to some solution. It is just generally worrying all the time. So they remain keyed up or restless and on the edge all the time. They get easily fatigued. have difficulty in concentrating their mind, and also because of all these things they always are irritable, and their muscles are always tensed. If you look at them, then they'll be always fidgeting. You see, if a person who is suffering from generalized anxiety disorder, they'll be always fidgeting, doing something in the hand, or they will never be sitting quietly. That will not be possible. So such people are always, very tensed up. They have sleep disturbance. Usually they have insomnia. That means they cannot sleep well. And any of these symptoms which are there should be present for 6 months or more to label a person as a case of generalized anxiety disorder. Okay. Now, coming to the definition, it is a broad term which is covering several different forms of abnormal psychological or pathological anxiety, or fears, phobias, and nervous conditions, which may have a sudden onset or may occur very gradually over a period of time. Now, I have shown some of the pictures here, which is to indicate that a person, how a person with GAD, may be looking like. One person who is all the time worried about the time, so he keeps on looking at the time, whether the time is getting up or getting over, and he is not being able to finish his work. So that is normally all of us are working in different fields. We know that time is from 9 to 5 or whatever it is, and we do our work and we don't really get perturbed about what the time is. But such people always, they look at the watch at least about 10 to 20 times during the entire period of this thing, and they feel always that they are not being able to cope up, not being able to finish the work in time. Or they may feel that they are walking a tightrope. It's a tightrope walk. If they go this side, they will fall. If they tilt the other side, they will fall. So such people are always on the edge. They always feel they are absolutely on the edge. And here I have shown the picture of the butterflies in the stomach. That sort of a feeling which many of them have. Now, signs and symptoms of generalized anxiety disorders are exactly similar to what I have told you in the initial stage. So all these are I have already covered, so I will not cover them again. Now, causes of generalized anxiety disorders may be serious or prolonged physical illness, personality type, which I have already discussed earlier. Type A personality, they are more prone to generalized anxiety disorders, and genetic. So any of these, and actually basically generalized anxiety disorders are multifactorial. That means there are multiple factors which work to produce this generalized anxiety disorder. It is not only one factor. Genetic may be there, genetic may or may not be there, but there could be other factors like personality type, or physical illness could be there, or circumstances which are coming up, that could be the cause. So any of these things, or they could have sort of been exposed to situations where there would have been what I will discuss in next, that is a post-traumatic stress disorder, where they have been exposed to excessive stress, loss of a very dear one, or having witnessed some dreadful thing occurring. So these people also can develop later on, they can develop generalized anxiety disorders. Now, treatment of generalized anxiety disorders are many. Medications are there, but medications of which include tranquilizers and also antidepressants. But basically, I am a medical doctor, but I am telling you that medications which are there for any of the common mental disorders like anxiety disorders, mild depression, etc., medicines are only temporary. That means as long as the person takes the medicine, the person will be free of those symptoms. The moment the person stops with medicine, the person will again revert back and again have the symptoms. So we have to support, the medicines are required for calming down the person, but what is more important is the psychotherapy. And in psychotherapy, the cognitive behavioral therapy is one of the modern day types of therapies which deals with making the person realize that that person's thinking process is not rational. See, we have got rational thinking and irrational thinking. So the person who is having generalized anxiety disorder, is his thinking process is irrational. That means there is no rationality in that. It is not logical. It is illogical thinking. So you have to, through cognitive behavior therapy, we have sessions, 1 versus 1 session, and we make that person realize himself or herself that the thought process which that person is having is irrational, and they need to change the thought process. And through cognitive behavior therapy, the person is helped to change the thought process from irrational to rational. And that's how the person understands that, yes, what I am thinking or what I am thinking as a problem is really not so much a problem. See, when you look at any particular thing, suppose I am taking a marble and I am keeping that marble about 10 feet away and I am looking at it, I think it's a very small marble. I take that same marble and I bring it very close to my eyes and I look at it, then I feel that it is a big, huge, big boulder. Okay, so it depends upon how you are looking at any particular object or a problem, and whether you are looking from only one perspective or you are looking from different perspectives. The same problem looked at from different perspectives will change, and the same problem which is when looked at it from one perspective is looking to be a very, very huge problem which does not have any solution. When you look at it from other perspectives, you will find that there are solutions to it. So cognitive behavior therapy uses this sort of principle to make the person realize and understand that the person actually can overcome that problem by his own effort. Then we have psychodynamic psychotherapy, where you make a person look within. Now all of us have certain fears which are embedded in our subconscious mind, and those subconscious fears many times come out in the form of anxiety. So in the psychodynamic psychotherapy, we try to take a person to look within and try to identify those fears which are there, which could be from early childhood. If a person during childhood has suffered from some traumatic event, then that later on gets into this subconscious mind, and that acts as a sort of a remembrance that there is something, some danger in that thing, and so person develops generalized anxiety disorder. So through this therapy, we try to take him within and identify that, and then make that person realize that it is not true, it is something which is being imagined by him because of the past experiences. Then of course we have self help or support group. That means that we help that person to himself or herself overcome this particular problem. And then we have stress management techniques or relaxation exercises. In relaxation exercises, basically we make the patient lie down and first of all calm himself or herself, lie down or even sit and calm himself or herself, and then consciously keeping the eyes closed, relaxing each and every muscle in the body, starting from the toes, coming down to the hips of one leg, then the other leg, then starting from the fingertips, going down to the shoulders, one hand, the other hand, and then starting from the abdomen to the chest, and finally the neck and the head. And tell, that means that when closing the eyes, you tell yourself that my muscle is relaxing, or this particular muscles of the calf have totally relaxed, the muscles of my thighs have totally relaxed. And then at the end of it, you will find that your whole body is absolutely relaxed and limp, and that is the time when you can totally concentrate on your mind and feel a sense of relaxation, and your mind also relaxes. Now through the relaxation exercise, you can get a person to de-stress, and this helps a lot in overcoming the anxiety disorder. Then of course we have meditation. Yoga and meditation is coming in a lot in the medical field these days, and even for people who are suffering from coronary artery disease or diabetes mellitus, yoga and meditation is being looked at as a very useful adjunct therapy. That means apart from medicines, yoga and meditation, they help in lowering the dosage of medicines to be taken and help in the improvement of a person's condition. And of course, family support. Most important thing in any anxiety disorder is the support of the family members. The family members have to understand that this person is suffering from a particular problem and he or she needs help, and so that help has to be provided by the family members. So when we do counseling, then it is not only that the individual himself or herself is counseled, but the family members are also called, and they also are told how they can help contribute and help this person to recover, and that is a very, very important aspect. Now, cognitive behavior therapy basically teaches the patient to react differently to situations and bodily sensations that trigger anxiety. So, the person is made to realize or recognize cognitive, that means he recognizes what are the triggers, whichever the triggers which are causing him or her to become anxious, and after understanding that, then the patient learns to control the thinking process, that change the thinking process, so that the thinking process from irrational becomes more rational, and that's how the person is able to help himself or herself to come out of the anxiety state. Now, example has been given like hyperventilating, that means you teach the patient to, okay, now you start hyperventilating, start breathing fast, rapidly, or you start listing down, write down the list of fears, which are what are the things which are causing the fear. Now, once he lists down the fears, then you take up those fears one by one, and then you challenge the person's fear as to why that person is fearing that, and make that person understand that actually his fear is irrational. There is no rationality in that fear. So, these are the methods by which you can teach the person or help the person come out of that anxious state. And gradually, that's how the patient learns to cope and learns to replace the negative feelings which are there in the mind with positive thoughts. There are alternative treatments like breathing exercises and pranayam, yoga, meditation I have already mentioned, nutrition and diet therapy. So, nutrition is also important in contributing to the improvement of generalized anxiety disorders. Vitamins particularly are important, and finally self-love. So, exercises are very beneficial. Whenever we exercise, you find that there's a proverb, a sound mind in a sound body. So, if you have a sound body, that means you are physically fit, your mind automatically becomes fit and you remain happy. So, the happiness, the quotient increases whenever we exercise. So, a person who does not exercise will always remain a little unhappy, whereas a person who exercises regularly will always become, that state of happiness enters the mind after you have done, certain amount of exercises. These days, we also have laughing clubs. In various places, we have laughing clubs because laughter is known to increase your immune globulins. Whenever you laugh loudly, then your immune globulin level in your blood goes up, and that's how there are laughter clubs which are there in various cities, and a lot of people join the laughter clubs and they laughing without reason, because even when you laugh without reason, that ultimately leaves you happy. You are in a happier state of mind. And this basically exercises, laughter, they expel the negative emotions and expel the excessive adrenaline which is released in the body. So, your tensions are released. Adrenaline causes tension. So, when the adrenaline, the quantity reduces, the tensions go out and your mind also feels happier. Meditation basically cultivates calmness and creates a sense of control of the life, and it establishes communication with your inner self or subconscious. So, method of thing, normally many people say that we don't know how to meditate. How do we meditate? Now, one of the methods is the relaxation exercises which I mentioned, where you ask your mind, or from your mind you are telling all the muscles to relax. So that's how the mind is controlling the body, and ultimately you start chanting any word, whatever word you want. I have mentioned here Om, but it can be anything. It can be Allah or any other particular thing. One particular word, you keep repeating that word over and over for 20 minutes or more, and just let your mind be without thoughts. You let the thoughts come in and go. Okay, but then gradually you will tend to go into a trance, or you tend to go into a state where your mind is absolutely without thoughts, and that is basically what is the meditative stage. There is another third method which you can use, where you just observe your breathing. You have to just you can take your finger, keep it under the nose, and just breathe in, breathe out. Breathe in, breathe out. Normal breathing in, normal breathing out. When you are breathing in, you feel a cold sensation on the upper surface of the finger. When you breathe out, you feel a warm sensation. Just concentrate on that, and when you do that, you will find that your mind has become thoughtless, because you are concentrating on your breathing. This is the life force. The breathing in and breathing out is the life force. So when you do that, you automatically find that your mind is become thoughtless, and this leads to a state of meditative stage. Now, foods to eat: you must eat whole grains, bananas, asparagus, garlic, brown rice, green and leafy vegetables, soya products, yogurt. These are all good foods to eat for avoiding generalized anxiety disorders. Foods to avoid: coffee, alcohol, sugar, strong spices, highly acidic foods, foods with white flour, etc. And you have to keep a diary of foods you eat, and then note whether the anxiety attacks are reducing. That means eating good foods, whether the anxiety attacks are reducing or not. So you keep a diary, and that thereby you will be able to see how the effect of the food is helping you to overcome the anxiety disorders. Now, there are vitamins like vitamin B complex group, vitamin B1, B3 and B6. They are very good for stabilizing the thought process and reducing anxiety. Calcium is a natural tranquilizer, and also magnesium. Calcium and magnesium, they relax the nervous system, and taken in combination, they improve the sleep pattern. Vitamin C is known to be improve the body's immunity. Whenever you have cold, then you normally, if you take vitamin C, your cold reduces or disappears. Similarly, potassium and zinc, they are other chemicals which are helpful to the body in overcoming any stress disorders. Ultimately, the most important thing is self-love. That means one must be able to love oneself. If a person loves oneself, and then what happens is that the guilt, many times the anxiety disorders are due to a guilt complex or a feeling of guilt. Now that guilt totally disappears when you start loving yourself. So many times, many of us are very harsh with ourselves. So that increases the problem in terms of anxiety disorder concern. So don't judge yourself harshly. Accept your faults. Every human being has got faults. There is no human being who is perfect without any faults. So accept those faults and your limitations, and love yourself. That is another thing which helps to overcome generalized anxiety disorders. And of course, there are certain nursing care which I am not going to go into in details. This is more for the nursing community. Now, coming to the post-traumatic stress disorder. Now, post-traumatic stress disorder, that means it is after a trauma. Once you have been exposed to a trauma, then after that this problem comes up, the disorder comes up. So that's why it's called as post-traumatic stress disorder. So patients who have experienced a trauma and then develop disabling symptoms in response to that trauma. Now, trauma can be a serious accident. It can be a natural disaster. Suppose a person has faced a tsunami, or a person has experienced an earthquake where the person has been trapped in a building and then got out. Or a very, very important example is the World Trade Center bombing which took place in the United States. So such trauma, if a person has gone through such trauma, then as an aftermath of the traumatic experience, it interferes with the normal life of the individual. So that individual becomes always becomes obsessed with those thoughts. Those flashbacks of those thoughts keep on coming, and the person is not able to overcome those thoughts and live life normally. So symptoms usually begin within 3 months of having experienced that trauma, and this can occur at any particular age. There is no age particularly involved. Now here I have shown some of the pictures. World Trade Center is there. In the center is a picture of a wartime situation where bombs are exploding. There are you can see that there are 2-3 tanks which are there, and bombs are exploding. So this is a wartime situation. So this post-traumatic stress disorder is very, very common amongst the military soldiers or military people who have witnessed a war. So the person has been involved in a situation where there has been actual or threatened death. That means either the person has seen someone dying, or he himself has been threatened with death or serious injury, or a threat to harm himself or the others. So that is the situation, and the person response is through intense fear, because that person has become so terrified that this terror or terrified sort of situation leads to the post-traumatic stress disorder, where a person feels totally helpless. Now types of trauma I have just mentioned here. It could also be sexual abuse or rape as far as a woman is concerned, any physical abuse, severe motor vehicle accidents, robbery or being mugged, and a terrorist attack, then natural disasters. So basically the person has been diagnosed with life-threatening illness, or the person has suddenly there has been a death in the family. Now that sudden death could be of some very close relative or a very close friend. Witnessing any violence, it could also be domestic violence. Now this can also happen to a child who has witnessed the father beating up the mother. That is also one of the situations where a child can develop post-traumatic disorder. When you suddenly hear, suppose a mother hears that that her child is suffering from a life-threatening disease. Now that can also be a trauma which can lead to this particular thing. So any trauma can lead to this disorder. Now symptoms should be usually start 3 months later, and it should be present for at least 1 month or more, and should include re-experiencing of the symptoms, re-experiencing of the trauma which that person has undergone, avoidance symptoms, emotional numbing, that means the emotions become totally numbed, and there is also hyper arousal of symptoms. Now what these terms mean, I will be talking about. Now re-experiencing symptoms. Now these are very recurrent intrusive thoughts in the patient's mind. That means the patient keeps on getting thoughts in the mind of that particular event which has taken place, and he just can't stop thinking about it. Now that situation is over. Okay, that particular thing, say World Trade Center or whatever has happened. Now that particular event or that particular disaster is over, but this person is constantly plagued with the thoughts of that particular thing. That means he relives that particular situation. He gets dreams or nightmares about that particular event taking place, and also the person all acts in a manner that actually that person is, that event is again recurring, or he feels that he is again reliving in that particular situation. So there are flashbacks in the mind constantly about that particular situation, and this results in psychological and physiological distress in the person's mind and body. Avoidance or numbing symptoms are, that means the person tries to avoid thoughts and avoid feelings and the places which arouse the memory. So the person will consciously try to avoid going to certain places or meeting certain people which are going to again arouse this thought. So this causes a disturbance in the normal life pattern of the individual, because that individual is consciously trying to avoid facing that particular situation. Being unable to recall important parts of the event, that means when you question that person, then that person will not be able to recall actually what all had happened. Okay, only certain things remain in the mind, remaining are forgotten. Then there is decreased interest in routine activities, feeling detached or estranged from other family members, so the person remains aloof and does not talk much. May the appetite also may go down. So there is lack of sleep or sleep disturbances. So all these things keep happening. Then there is hyperarousal symptoms. That means patient experiences at least two of the following. That means there could be inability to sleep, as I have just mentioned, insomnia, irritability or outburst of anger. So that person is trying to rebel against that particular trauma which had taken place. So there is outburst of anger. Decreased concentration, so the person is not able to concentrate, cannot read the papers or read something. Then there is hypervigilance. Now what is hypervigilance? That a person is very much always tries to find out that and remains alert. Something will go wrong. So they'll look around here and there. They'll suspect people. So that is known as hypervigilance, where they are highly feeling that always their security is being threatened. Okay. So hypervigilance thing. Then increased or exaggerated startled response. Now if I suddenly while talking, now suddenly I say fire, fire. Okay, that is startled. You get startled. You look, where is fire? Okay. So in these people, that startled response is exaggerated. Okay, even slightest amount of noise, you'll get startled. Okay, so that is a startled response. Now this PTSD is generally present in about 1% of the population, and it can be as high as 25%. Particularly it has been seen in the World Trade Center attack. About 25% of the people who were present in that particular site, or they were inside that building, World Trade Center, almost 1/4 of them suffered from PTSD. It is in combat veterans, that means the military people who have faced war, as many as 1/5 of them, 20% can have this, and very high prevalence is seen in women who are victims of sexual abuse or sexual trauma. Now coming to the treatment, now there are medications which are available, basically anxiolytics, that means which reduces your anxiety. So anxiolytics and antidepressants, these are recommended. Atypical antipsychotics are now being also increasingly used. There are certain antipsychotic drugs, that means psychosis is a situation where there are certain changes in the brain which produces diseases such as schizophrenia or bipolar response, bipolar problems, and also there could be persons who develop persecutive complex. Persecutive complex means that person always feels that that person is going to be harmed by someone, that someone is going to come and murder him, or someone is going to come and hit him or something. So that is persecutive concepts. These are psychosis. So there are certain drugs which are used in psychosis. Some of those drugs are also now being used for treating PTSD. That is as far as drug therapy is concerned. Then psychotherapy is basically again cognitive behavior therapy is very effective in PTSD, and this is basically aimed, the cognitive behavior therapy is aimed at the survivor anger and guilt and helplessness in being victimized. That means those who have survived, they gradually develop a sense of anger. Okay, now in the WTO thing, in the World Trade Center bombing, there was a tremendous amount of anger in those who had survived but lost some of their dear ones against the perpetrators of the terrorist act. Okay, so this also needs to be, the anger also needs to be subsided, otherwise it will lead to unnecessary feelings of hatred and harm, or the person will try to cause some harm to the people who have done, the terrorists who have done the act. They are no more, they are already killed. But that hatred can not only cause harm to others, but cause harm to your own self, because the more feelings of hatred we have in our body or in our mind, that is going to eat us up gradually. So that needs to be calmed. So that is important as far as psychotherapy is concerned. And then stress management, through stress management techniques that I mentioned earlier. And these are some of the nursing interventions. Assign the same staff as far as possible to look after the patient, so that there is no change in this thing. And stay with the client during the period of flashback. That is important, that when the patient is having a flashback of the event, you must stay with the patient, calm the patient, and try and if possible, if the psychotherapist is available, then during such situations the psychotherapist also tries to make that person understand that in reality that situation is not there. You see, just now that situation is not there, that is already past, and make them understand that and make them overcome this flashbacks. Encourage the client to talk about the trauma at his or own pace. Now, one of the methods in psychotherapy is catharsis. Catharsis basically means a diarrhea. That means when you have a diarrhea, when your entire intestine pours out whatever is the problem inside the intestine. So you keep going to the toilet, maybe you go to the toilet about 10 times. Now that is known as catharsis. Okay, so in psychology, in psychotherapy also, what we do is catharsis. That means you allow the person to bring out all the things which are troubling his mind. So let the person talk. If the person talk, let the person cry, laugh, whatever it is. So once that person has gone through that, then the mind feels lighter. So that is one of the methods of psychotherapy. Discuss the coping strategies used in response to the trauma. So teach them how to cope and help them to cope with those traumatic events which have taken place, and assist the individual to try and understand the trauma. Why is that trauma? Understand the trauma and try to overcome and come out of that trauma. So these are the nursing techniques which are used in post-traumatic stress disorder. So thank you so much for a very patient listening. Now if you have any questions, I'll be very